Welcome to the University of South Carolina College of Pharmacy podcast. I'm your host, Margaret Gregory, and today we welcome as our guest Dr. Jill Michels, Director of the Palmetto Poison Center. Dr. Michels, I'm so glad that you could be with us today to talk more about the Palmetto Poison Center and the role it plays in keeping South Carolinians safe.
Thanks, I appreciate you having me here.
So first, tell us a little bit about your background. You're an alumna of the College of Pharmacy, and how did you become interested in the field of pharmacy?
So I actually had a friend who worked in the Poison Center part-time during school. We used to have students who'd work in the Poison Center, and so I'd go up there in the evenings and study when she was working and got interested in what they were doing, and that's what kind of propelled me to where I am today.
Tell us how you got to the Palmetto Poison Center through your career.
Going through school, going up there, kind of seeing what they're doing a rotation in the Poison Center. And then after I graduated, after my PharmD year, I did a PGY1 at Emory. And I already had planned to do an elective in toxicology, and I was still trying to figure out what I wanted to do. But by the halfway through Emory, I knew this is what I wanted to do. And so I actually, during that year, had applied for the toxicology fellowship at the Georgia Poison Center, and then was able to finish up Emory and then go on and do that as well.
You have a designation as a diplomate of the American Board of Applied Toxicology, and as I understand, you're the only certified toxicologist to have this designation in the state of South Carolina. Why is that important?
For me to be the manager and to be a clinical manager, to know what's going on in the center, to make clinical decisions, and even take phone calls, I need that background. And so not only am I lending my expertise on the phones, but then the staff can also call me as well. One of the things about the Poison Center, you're talking to someone who certainly is educated in toxicology. They're nurses and pharmacists full-time who answer the phones, but always have backup just in case, and we have board-certified physicians and board-certified in medical toxicology and usually emergency medicine, and so they take call, and with my designation I can also be on call if I need to.
Let's talk about the Poison Center itself. Share some of the history of the Palmetto Poison Center and how it came into being.
It's been around a long time. From at least my understanding of some of the history, it may even go prior to this, but like in the late 60s, early 70s, it was a phone number, a phone that rang over at Richland in their ED, like in a closet basically, in a little room. And so whoever's walking by would pick it up and answer it. And then the college in the early 70s hired Brooks Metz, who was the managing director when I came on here. And he had, I don't know his full background, but I know he had some toxicology background. And so they hired him to be the managing director of the Poison Center. And so he's the one who grew it into the center, and then they at some point moved over to USC's campus. I know also in the 70s there were actually two poison centers. There was one here and one in Charleston, and the state put it on RFP to have one poison center, and luckily they picked the Columbia one to stay open. So that's some of the history.
What are some of the specific issues that you commonly address with the Poison Center? What would someone call to ask you about?
Oh, it can vary. Certainly people always think, my kid ate toothpaste, I need to call the Poison Center. And certainly, that is what we're here for. But it can be the kid eating toothpaste, getting into the pesticide, getting into the household cleaner. But we also deal a lot with medication management, quite honestly. Double doses, or you take another family member's medication. And one of the neat things about what we do in the Poison Center is if we can keep you at home and monitor you and do back and forth phone calls, we will. So people who are on insulin and they may take the wrong dose of their insulin, so we have them check their insulin throughout the day. We do follow-up calls on them to check on them. Same thing with blood pressure medication errors. We can do that as well. So it's not just a one and done type of phone call sometimes with us. It's monitoring you throughout the day if we need to. I worked Monday on the phones, and a lady had taken a double dose of a powerful antidepressant medication, and so I ended up calling her back twice over the course of the afternoon just to check on her and see how she was doing, and she was very thankful. So medication management from that perspective. We also deal certainly with intentional overdoses, whether that's intent to harm or intent to abuse, and that can be certainly calling from the home, someone calling about a loved one in that situation or themselves, or even hospitals. A lot of the calls we get, people understand as well, hospitals will call us after a patient comes into their emergency department because they want information from us. Basic information on how long to watch this patient for, because they're busy. We don't need to keep someone in the hospital more than they need to be. What symptoms to watch for, what labs, if any, the patient needs, and then what antidotes or treatments. And so not only are we consulting and providing them information, but we can also be a cost savings because, maybe in a situation where you don't need to get labs on this, but we need to check their vital signs. And then we also, if that patient is admitted to the hospital, we follow along basically till their symptoms have resolved from the poisoning. So again, we can not only collect data to learn things, but then we can also provide treatment management as well. Like, yes, you need to continue this antidote, or no, they've had their symptoms resolved from this, we can stop this now or stop this type of monitoring. So it's more than just the toothpaste call. It goes beyond that. So it can be a technical call, talking to grandma about a child eating, a flower outside, to then the next call is attending in the ICU the multi-drug overdose. You just never know what you're going to get. We've already had 72 snake bites called into the poison center this year alone. So it's going to be a busy snake bite season. We had over 300 calls last year.
So it sounds like the poison center, through all of the assistance that it provides to patients, to hospitals, and to those who call in, it's a tremendous cost saver.
It is. The last cost savings they looked at, for every $1 spent on a poison center, you save over $13 in unnecessary health costs. The only other public health initiative that saves more money is childhood immunizations. So it is a huge cost savings to the government, to insurance companies. And not only that, just think about your perspective. You're the parent. You necessarily don't have to miss going to work, so you're not missing out on wages. The child can go to school or daycare, whatever it may be, so your day is not interrupted. And then you're also, again, not spending unnecessary, health costs.
I'm sure that because of the follow-up care that you provide, it provides a great sense of ease and comfort.
It does, that someone is aware of the situation. We gave the information, but hey, we're going to call you back and check on you. And I always tease sometimes, I'm necessarily not calling back on the patient or the child that got in something. I'm calling back on mom or dad to make sure they're okay. I tell people that's what we're here for, or they apologize when it's something that's not a big deal or it's not necessarily going to cause symptoms. Like, no, that is what we're here for. So you call anytime. I want to tell you it's not a big deal. There are some things that child ingest one tablet, and it could be a medical emergency, you need to go to the hospital. There could be something the child ingests 10 tablets, and I'm like, it might cause a little tummy upset. But that's what we're here for.
What is your typical call that you get?
It's what is in your house right now. Medications, cleaners, pesticides, healthcare products. So typical things you'd have in your house, or we're going to get calls about.
One of the things that the center also provides is education out to groups. Talk a little bit about the different subjects that you cover in some of your education seminars.
Yeah, we have a full-time health educator for the community. Her name is Christina Dorenzo, and she does an outstanding job. So 2 things we've specifically done, certainly to school-age children, and then we also, we think a group that's kind of gets overlooked in that we always think children and poison safety, but the elderly. It can be confusing when you look at a medicine label, even over the counter, to understand everything. And so we go through that step by step so they understand that. And then they also know that we are going to be a resource for them if they do have a question. Because we don't just take poisoning calls, we do handle drug information questions. So we're there for them as well. But certainly if they do have an error in their medication, they can call us too.
And I would imagine that as the population ages, that's an issue that might continue to grow.
Certainly. And besides that, which is another overlooked area for seniors, is they are sometimes the caregiver for grandchildren or the guardian, and they haven't had a child in their house for 20 or 30 years. Christina also does training for foster parents around the states. So again, we try to get those people who may be overlooked when it comes to training and safety, because we want to be there for everybody.
If someone wants to get in touch with you to learn more about the Poison Center, to make a call, to read more about it on the website, what are the different ways that they can get in touch with you?
Sure. We have a website, poison.sc.edu. We're out there on social media platforms, but then we also have an 800 number, 1-800-222-1222. And what's special about that phone number, every poison center uses that phone number. So it's a nationwide number. And what it does is it routes you to the closest poison center to where you are. So you always, no matter if you go on vacation, you use this number, you're going to get a poison center who's going to help you. And when you call, again, our staff are nurses and pharmacists trained in toxicology. So very smart people who can help you.
Thank you so much for sharing your time with us. I know this is very valuable information for everyone who's listening.
Yeah, appreciate it. We always want to get the word out.
We've been talking with Jill Michels with the Palmetto Poison Center. Tune in again for our next edition of the USC College of Pharmacy podcast.